In order to be really truthful about the regression, I have to say that, and I have often said this to other moms, that the regression was subtle and yet obvious.
Around the age of 13, 14 months, we started noticing that he was not babbling or making noises or speech like most children. And by the age of 2, we became very concerned. We thought possibly he was deaf. He was not responding to his name. He did not seem to respond to environmental noises or others around him. Emotionally, he was very closed off.
Kids with ADHD or autism want to be independent. Try Goalie, the visual scheduler that guides them through routines so you don't have to. Goalie, reinventing routines.
When he was about 15 months old, I noticed that he had stopped talking. He had started to say sounds and a few little words, mama and dad, that sort of thing. But at that point it stopped and there were very few sounds and no words.
Behaviorally, he was very nervous, very agitated, very anxious. And as he passed the second birthday, he still had no speech, and then he started tantruming and become very panicky. And he used us quite a bit. If he wanted something, he would never communicate verbally, but he never pointed or gestured, but he would pull us. If he wanted something to eat or drink, he would pull my wrist or my hand to the object, and his eye contact was very poor.
These children withdraw into themselves. There is so much stimulation around them that it's confusing. It's confusing to their neurological systems. It's confusing to how they even move in their environment. It is confusing in terms of what things are in their environment.
For families living with ADHD or autism, preventing meltdowns is everything. Goalie reduces stress by enabling kids to complete routines independently. Goalie, reinventing routines.
As the science of autism progresses, researchers are finding certain core symptoms that are nearly universally present in cases of autistic spectrum disorder. No two children are alike, and not all symptoms are present to the same degree. But by looking for specific features at every well-child visit, parents and physicians can positively identify autism. Dr. Stephen Mott, a physician and expert on childhood development, explains these core symptoms.
Those being language regression or social interaction regression. This can show itself in terms of decreased eye contact when eye contact had been present previously, or a decrease in communication skills where a child may have pointed, handed objects to families, exchanged appropriately, and then now does not make eye contact, does not point, in fact may actually act as infants do in that they have to make sounds, repetitive motor movements, and then parents have to guess exactly what their needs are.
We believe that many of the children who are apparently normal but then regress around 18 to 24 months of age actually have abnormalities that are detectable during the first and second year of life.
It begins with a pediatrician.
Probably about 2.5.
Being willing to listen to the parent's description, particularly about changes in language development or looking at language milestones, and then identifying how or what types of services the child could benefit from even during early infancy.
The practice parameters are devised to pick up children with routine developmental surveillance who have any kind of communication difficulty. At 12 months of age, every child should be pointing and babbling. If a child at 12 months is very quiet, that should be a hallmark. If a child at 12 months is extremely independent, that should be a hallmark. There are specific questions that are aimed at socialization, communication, and other areas, developmental areas, that should be asked of every parent at every well-child visit. By about 7 to 10 months of age, babies learn the power of the index finger. When they learn to start pointing and mommy and daddy jumps every time they point to something, the beginning of communication, and they start babbling, that is traditionally missing in the children with, quote, normal language development by age 2, but impaired socialization.
Kids with ADHD or autism want to be independent. Try Goalie, the visual scheduler that guides them through routines so you don't have to. Goalie, reinventing routines.
One of the earliest signs of autism is that the child doesn't develop play normally. Normally, babies in early infancy, they will mouth the object, they will visually inspect the object, and then they will move on to use this object for what it's intended to be used, like pushing a car or using a toy telephone. And these are things that children with autism will not do.
They may mouth objects and continue to mouth objects on into toddlerhood and early childhood. They may visually inspect objects and focus on parts of objects like opening and closing the door on the car or spinning the wheels of the car.
He was always a quiet child. And then when he got fussy, I would get my necklace and get my necklace off and I would give it to him. He would be playing with the necklace and he was content with that. So I did that as a habit. Whenever he got fussy, I would say, oh, here, pass this on to Ramsey. And he would get a hold of the necklace and he would play with that necklace like for an hour.
Or they may have repetitive lining up of Legos or cars in rows, but they do not make a move to use the object in an imaginary or symbolic manner.
A child's play habits can be very indicative of a developing problem. If a parent notices anything odd regarding their child's play, their physician should be made aware immediately. Sleep problems are another indicator that something may be wrong.
It is very important to assess sleep in every visit in a child with autism because the degree of sleep disorder often seems to correlate with the severity of autism and often seems to improve as its symptoms improve.
Another problem that children with autism have, they have problems with stereotypical motor movements, like they flap their hands or they may jump up and down a lot.
He ran in circles, he jumped on tables, he pushed things over. He was nonverbal, they couldn't communicate with him. He had no idea that there were rules and there was appropriate behavior, and he was not behaving well.
Language development also often regresses to some extent in children with autism.
The language regression may be that they could be speaking single words, 2 words in combination, and some by age 2 may be speaking full sentences, and then this rapidly regresses to any degree.
Autistic children often display stereotypical behavior. For example, hand flapping, jumping up and down, incessant rocking, or repetitive patterns of behavior.
It is very important then that we begin to understand how to detect these abnormalities in order to arrive at an early diagnosis so that we can begin treatment as early as possible.
Certainly as part of our routine evaluations in the office, we've always looked at development closely, and especially in that second 6 months of the first year and in that next year thereafter, language development is an extremely important part of what we do. And we paid close attention to how babies babble and coo and respond to people and development of first words, which may happen anytime at first at about 1 year or so.
Some of the things that you may look for are the child's eye contact as you see them walking into the room. I make these observations as I go out to greet the family. Does the child recognize my presence? Does the child make any efforts to make eye contact with me? If I say hello and put my hand out, does the child recognize that I put out my hand?
Looking for either regression or a total lack of progression in any of these areas at every well child visit starting at 12 months or earlier can pinpoint any possible problems early on. If a child exhibits any difficulties at any stage, it's important to then take the child to the next step and formally test for any particular developmental problems.